Hello everyone, this is Dr. Sultan Moinuddin Shauqatani, MBBS, MD and DNB in radio diagnosis from SAID GSMC and KEM Hospital, Mumbai. I welcome you to learning radiology and learning ultrasound. And what we are going to see here in this session is about thyroid ultrasound. So in this session, I'll be talking about the technique and the practical demonstration of thyroid ultrasound. Okay. So without any delay, let us begin with the technique and practical demonstration of thyroid ultrasound. So before I start with the actual technique part, yeah, before I start with the actual technique part, what I would like you to know is the basic fundamentals so that things are crystal clear. So number one is when you are examining the patient, you have to make the neck extended. So your neck should be extended. For example, if this is the mandibular lining, the neck should be well exposed. The entire neck should be well exposed. Along with the neck, the clavicular region should be exposed. The region of manubrium sterni, so suprasternal notch. Here lies the manubrium. Here is the joint with the clavicle. So this entire region should be exposed when you want to examine for either neck or you want to look for thyroid. Both of this, any of this is the basic prerequisite when it comes to examining thyroid or neck. Okay. Now, as a normal important thing, I want you all to see my session on introduction of thyroid. जिसके अंदर I've talked about uh, entire details on when do you do for neck, when do you do neck ultrasound, and when do you go for thyroid ultrasound. There are lots of indications, just few to enumerate: any thyroid swelling, midline swelling, thyroglossal cyst, in case of thyroiditis, in case you suspect thyroid malignancies, thyroid nodule, whether to characterize it as malignant or benign. So all these are important conditions where you look for thyroid ultrasound. Now, thyroid gland is located somewhere here. So, in this region, you have the isthmus, and you have got the left lobe, and you have a right lobe sitting here. So, this is how you look for thyroid, and you have a trachea which goes here centrally. So, centrally, the trachea goes in a form which has got tracheal rings. So, this is how the trachea will be going in the center, and you find that thyroid is positioned in this way. Now, two important things which I would love to talk here is when you are looking for thyroid, if you take a section like this, so you would get image which is somewhat like this. कैसा आएगा image इस तरह से. That is the transverse section, and here would be the trachea. So this is transverse section of thyroid. If you take, if you put the probe like this, that is perpendicular to what you had placed previously, here you would get the image which looks somewhat like this. That is longitudinal section of the thyroid. Okay. Now, so when you are looking for thyroid, you have to either go from above below or below above. So whatever you decide accordingly, but most important is you have to scan along the entire lobes. So suppose you start from below, in the transverse section, you have to scan throughout from below upwards. First the right lobe, then make the probe perpendicular, scan it from right to left throughout. Then you look for the isthmus in transverse and longitudinal sections. Okay, so isthmus would again appear like this. So in case if you are looking it in transverse section, you would see that there is a tracheal lumen, and above tracheal lumen there is isthmus like this. These are the lobes of thyroid. This is how you see it in transverse section. And you measure the AP distance, that is anterior-posterior diameter of the isthmus. If you make the probe perpendicular along this, that is in longitudinal section, you get image which is somewhat like this. You see that there are tracheal rings, okay, and the isthmus is like this. placed over the trachea. So this is what the type of image you get. Also, you scan along the isthmus from superior to inferior and from right to left or left to right to look for any nodules if present within the isthmus. Just like we did on the right side, we also look on the left side for presence of any cysts or lesions in transverse section from superior to inferior. Similarly, in longitudinal sections from left to right or right to left, whichever is fine. Okay. Now, whenever the thyroid gland is enlarged, we are suspecting thyroiditis. The another important thing is you look for vascularity within the thyroid gland. So these are very important features. Especially we have seen that in case of thyroiditis, whether it is Hashimoto's thyroiditis or grave in initial phases, we find that there is increase in vascularity. So increase in vascularity is a very important sign of thyroiditis. Similarly, if you find any thyroid lesions, like you find thyroid nodule, you find that you get a thyroid nodule, then again in case of thyroid nodule we have to give a specific grading which is called thyroid's grading system. So I would suggest you to go to my lectures on thyroids. We have 3 recorded sessions on thyroids, and so you can where I have beautifully covered the entire thyroids, how thyroids is grade, how what are the important components which are included when you label the thyroids. Okay. Now sometimes you find that there is cyst. In cases of cyst, always put a vascularity and see whether there is solid component or not. If there is solid component within the cyst, you have to mention that. You should also look for echogenic foci. We have a separate session on that where I have discussed about what are the various echogenic foci, what are the types of calcification, comet artifacts, etc. etc. So I would suggest you to go to those specific lectures as far as all these specific topics are concerned. In this session of ours, we would be discussing the practical points of ultrasound of the neck. Okay. Before we start with, one last point which is left out is that along with thyroid, we should also scan for lymph nodes. So sometimes you might have enlarged lymph nodes along with thyroid. Now this can be in the form of reactive nodes. Uh, we have talked in details about how a reactive node looks like. And second is you can have metastatic nodes. Uh, Metastatic nodes. So, but just to brief you, even in this, so that you don't confuse or you don't make a wrong diagnosis. See, if this is a node, what you look for is a central hilum, and you check for vascularity. So you see that there is a vessel which goes inside the hilum and which supplies the lymph node. This is how you see. This is how you see normally in case of reactive node. Then we saw how a necrotic node looks like. So if there is a necrotic node, you find that the hilum, if necrotic node nearly becomes round, there is loss of hilum, so hilum is not there. And if you put vascularity within this, you see that there is no vascularity within the lymph node. There is no vascularity within it. Okay, there is no vascularity within it. So no vascularity, no hilum. This is how a necrotic lymph node looks like. The third important thing which we should know is a metastatic node. So how does a metastatic node looks? Enlarged, lobulated, and most important part is metastatic node is heterogeneous. So hilum may be bulky and the entire node is heterogeneous. So heterogeneity is a very important feature. Okay, it is heterogeneous. And moreover, you have seen that especially in case of papillary carcinoma of thyroid, जब भी papillary CA रहता है तो pap CA के अंदर we get there are lots of calcifications within this lymph node. So metastatic nodes in case of papillary CA can show calcifications within it. So these are all the important features of thyroid ultrasound which are to be kept in mind when you start examining for thyroid. Okay, now with this warm up, what I want you all is to look carefully the demonstration video so that the things become very clear to all of you. Okay, now okay, so now this is where the patient is positioned, and we are clearly able to see how the patient is positioned, and you are able to see that on this screen We are able to see the thyroid on one side, and we are able to see the uh, so we are able to see thyroid on one side, and we are able to see thyroid on one side, and we are able to see the ultrasound which is getting demonstrated on one side. Now this is the isthmus which is getting shown here, the isthmus of thyroid gland. Now we are scanning along the this is the right lobe which is pointed. This is the left lobe of thyroid gland. You can see behind the left lobe, this is the esophagus. These are the strap muscles. Now we are moving from below upwards in transverse section. So this is how we are moving again from above downwards in transverse section. So this is how we have to look very carefully along both the lobes, isthmus. We are measuring the isthmus, the AP dimension. So here it is hardly 2.7 mm, which is normal. If it is more than 1 centimeter, that is enlarged or abnormal. Here again, you are able to see the right lobe of thyroid. This is the carotid artery which is showing pulsation. You are able to see a well-defined anechoic cystic lesion and few cystic spaces in the right lobe. What we do is we'll put a vascularity. Yes, so now you can see that the cyst is not showing vascularity within it. That confirms that this is a cystic lesion and not a solid lesion. So here this is a cyst which we are able to see in the right lobe of thyroid. Now again, this is we have taken a dual view, and now we are seeing the right lobe of thyroid in longitudinal section and transverse section here. So now this is the AP dimension, this is the transverse dimension, and this is the craniocaudal dimension. So we have to take all these three dimensions. Now we are scanning from outer to inner. This is the isthmus. Those are tracheal rings. Again, we are moving from inner to outer. We are checking for the vascularity. So this is the normal thyroid vascularity which is getting beautifully demonstrated here. We are also able to see that cystic lesion in the right lobe of thyroid. Now we come to profuse jelly should be used so that the image obtained is good enough. We are able to see this IJV. This is the carotid artery. IJV is compressible. That means that it is normal. There is no thrombosis. This is the sternocleidomastoid muscle which is overlying the vessels. We look now for lymph nodes. So here you are able to see a well-defined hypoechoic lymph node with hilum preserved. We are measuring the size of lymph node. It is small. This is sub-centimetric, so less than a centimeter, 4.5 mm in maximum diameter. So short axis diameter is more important. I've talked about in previous lectures too. So we are scanning for lymph nodes in the supraclavicular region. Again, you are able to see the subclavian vessels here. These are the subclavian vessels, and we look for any lymph nodes if any. Now we also see for the submental region. So these are the digastric muscles which you are able to see, and we screen for if there is any. So this is a small level 1 group, level 1A group of lymph node in the submental region which we are able to see. Okay. Hope you have enjoyed. You understood what the technique of ultrasound is followed when it comes to USG of thyroid gland. Hmm. So what I want you all is go through this recorded session again and again, revise it, also see my sessions on thyroids, also see my sessions which I've made on neoplastic lesions of thyroid, thyroiditis, diffuse thyroid lesions, and all of this will help you to be very sure in thyroid pathologies, and will you will be a fantastic sonographer when it comes to thyroid pathologies. Okay, thank you. Your feedbacks are welcome.